May the luck of the Irish be with us this week, St. Paddy's week, and St. Paddy's Day being Monday. So we say, Erin, go braless. What? It's time now for Pet Tips on Eagle Country 106.3, sponsored by Town and Country Veterinary Clinic, just up the road a piece from Eagle Country. So this week we're talking about heart disease.
So I'll say top of the morning to you.
Top of the morning.
So yeah, we're going to talk a little bit about heart disease because when you look at heart disease in dogs, it's probably the third biggest reason for dogs passing away. If you look at them statistically, number one is cancer, number two is kidney disease, and number three is heart disease.
That's up there.
Yeah, and with hearts, basically, it's typically chronic valvular disease. It's the most common change that we see in hearts, and that's so the valves are those little kind of saran wrap looking thickness things that close and allows it to eject. It's a valve system, but over time, due to wear and tear, colonization of bacteria from dental disease and things like that, those edges get frayed and torn up. Okay, and so they don't seal properly, and so you get a back jetting. And what happens then, any blood that's back jetted to the back chamber has to be repumped through, so the heart's having to work twice as hard. Okay, it's kind of like when you have your kids do the yard, you might as well just do it yourself because you're going to have to end up doing it anyway, so it's twice the work. So, and it's the same thing, and so over time then that causes heart enlargement, that causes congestive heart failure. And congestive heart failure secondary to chronic valvular disease is probably the most common thing that we see. Now, so people say, well, I'm worried about getting a heart attack. And while those do happen, usually it's chronic progressive heart failure that happens. And that's different because we think of, you think of Fred Sanford, Elizabeth, I'm coming. Yeah, that's not typically what happens, although that does. We just saw one the other day that had a life-threatening arrhythmia and kaboom. But a lot of times those collapses are due to basically depleted oxygen because we just can't, deliver it. Now, here's the thing. Just because you've got a dog that has heart disease doesn't mean you just have to throw in the towel. There's a lot of things that we can do. In the old days, we would do vasodilators, and we still do, and then we would do like a diuretic, and we ease on into it. Nowadays, the research indicates that if we adopt a shock and awe approach, where we basically throw everything at them early, we see much better results in the long run. And that actually comes from research that we're seeing on the human side. And so the veterinary cardiologists are adopting that same approach. And we've in fact been doing that now for probably a couple of years and have seen better results. So oftentimes, like if you come in with a cardiac patient, I'm not sending you with one or two dogs, I'm probably going to send you with four. And also too, if you have a dog that has cardiac disease and you're on meds, one of the best things you can do for yourself is go ahead and buy one of those Sunday through Saturday pill boxes. Okay, because oftentimes it does get confusing with these, but there's a whole lot of things that we can do. Now, you say, well, how do I know if my dog has heart disease? Okay, it's that chronic nagging cough that keeps getting worse. Now, if it's an acute coughing my head off, that's something else. Okay, but if that acute cough has been kind of coming along for the last few weeks,
and it ain't going away, and if you really think about it and
quiz yourself and think it's probably been a couple months that the dog's been slowing down and this cough has been getting worse, that's the one you want to be aware of. And basic minimum database for a cardiac workup is chest x-ray, well, physical exam obviously, chest x-rays and an EKG. Okay, and then based on those, determining whether, what else needs to be done. But those three things can be done very quickly. They can be done in clinic rapidly and get some ideas as to what's going on. And of course, getting medicine on board to help that pet.
All right, and we'll be back right after this.